My name is Inga and I am yoga therapist. This is class number 3 for sciatic nerve pain. How to reduce sciatic nerve pain. So I assume that you did class number 1 and class number 2 for a reasonable period of time, and your pain is already almost gone. So now this class is going to be more for strengthening of your lower back, and also if you have little bit pain coming sometimes, just to finishing to remove it completely, that it would never bother you again. So when you're ready, let's go to the child's pose.
And take few breaths in a child's pose, just observing how it feels. Now from child's pose, we're gonna come on your hands and knees, curve your back, and take one full breath. Inhale and exhale. After one breath, we're gonna go to downward facing dog. And if you're doing this pose for the first time in your life, open your feet to the sides of your mat, push the floor away with your hands, so the weight should be on your hips, not on your arms. You can bend your knees if you need to. Your heels may be gonna be lifted off the mat. It's okay. The most important thing is that we're extending our back, our spine. So we're gonna stay there one breath. Breathing this breath. After this one breath, we come back on your hands and knees and stay one breath there. Child's pose. Stay one breath. We're gonna repeat this flow 5 more times. So we're staying one breath in each position. Don't be in a hurry. We have 3 more rounds to go. Last round. When you finish your 6 rounds, take a resting breath in a child's pose. Now we're gonna lay down on your belly. Take your time, no rush. And if you have enough flexibility, we're gonna do the full cobra pose if you're able to do that. But if not, don't worry, you can do the Sphinx pose, what we did last time. So you just choose what is appropriate for you at the moment. I'm gonna demonstrate full cobra pose. But remember, even if you're gonna do Sphinx pose, the half cobra pose, the results are gonna be also very good. It's not gonna be half results, okay? So now we're gonna do same breathing. So we're gonna take breath in and out. After exhalation, we're gonna lengthen the back. Rise your head, your chest up. Don't do your shoulders like this, but shift your shoulders off. Take one breath. After one breath, we're gonna lay down on the back, on the belly, and take one breath. We're gonna repeat this flow, rising up, breathing in and out. Slowly lowering down, breathing in and out. We have 3 more repetitions. Last one. Rest. Turn your head to the one of the sides. Extend your arms by your side, palms facing the up, and just breathe and relax. Feel the flow of prana, feel the flow of breath through your whole body. Turn your head to the other side and rest.
The next practice is gonna be on your back. So take your time in your own comfortable way with no rush, no hurry. Change the position on your back. Bend your knees and we're gonna do same thing like in a class number 1 and 2. If you have pain on your right side, you take your right heel closer to your hips. If you have pain on the left side, you have to take your left heel closer to your hips. So today I'm gonna assume I'm having pain on the left side and I'm gonna take my left heel closer to my hips. So observe how you feel in this position. Connect with your breath. And when you feel ready, take a breath in and out in this position. On a hold after exhalation, rise your hips up, arms over your head, and take one breath in and out. After one breath, slowly return your hips on the ground, your arms by your side, and take a breath in and out. We're gonna repeat this flow. On a hold after exhale, rise your hips up, take a breath. Rise your hips down, take a breath. We have 3 more repetitions to go on your own breath. Last one. Extend your arms by your shoulder level, palms facing down. Keep your heel wherever it's closer to your hips. Now, today I am assuming I have left side sciatic nerve pain issues, so my twist to the sides are gonna be right, left, right, so opposite of the side what I assume I'm having pain. So taking breath in, exhale, relax your knees to the right, and now we're gonna take breath in and out in this position. After this breath, inhale your knees and head to the center, exhale to the other side. Take one breath there. Inhale, knees and head to the center, exhale to the other side. Always take one breath on your knees to the one side. So we finished one round, we're gonna do 2 more. So inhale and exhale. Last round. Take your knees to the chest when you finish. Now we just gonna counter pose all that. Inhale, extend your legs to the ceiling, flex your feet, arms over your head. Exhale, slowly your knees to the chest, wrap with your arms. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. 3 more repetitions. When you finish your 6 repetitions, return your feet on the ground, carefully roll over on your side, and come up to the seated position. And just reminding you that this practice you have to do every day for at least month or 2 months, for a long time. And if you combine all these 3 classes, number 1, number 2, and number 3, it's gonna take you about half year to go completely out of your sciatic nerve issues. But you have to remember one thing. I always say that group yoga classes are like, vitamins. When you're healthy, you just go to the store, you choose vitamins, and you're gonna drink them or not, you're gonna feel more or less same. But when you're sick, you go to the doctor, right? And you go to doctor one-on-one, and doctor is giving you medication for your issue according to your body, your health, and the goals you want to reach. And you have to take this medication every day, same time, for the certain period of time in order to heal. Same with yoga. If you have no issues, participate at the group yoga classes, and you're gonna be more relaxed, you're gonna have more flexibility, and of course it's gonna, you're gonna strengthen your body, your mind is gonna become calmer, you're gonna have all these great benefits from group yoga classes. But if you have pain and you doing yoga group class for the certain period of time and it's not helping you to reduce the pain, or maybe it's reducing but temporary, this means you need to go to yoga therapist. You need to get your personal yoga therapy practice designed specifically for your body needs and for the goals you want to reach. And you have to do this practice for the certain period of time. You also can do group yoga classes while you're doing your daily yoga therapy practices, because as you saw, they are very short, usually 10 or 15 minutes, 20 minutes, it's enough. But this is how yoga is gonna help you. So I just want to tell you, like I always say at the end of my sessions, for all this knowledge, I am very thankful to my teachers. Be healthy, free of pain. Namaste.